to introduce our guest, Dr. Malini Chandrasekharan, Medical Director South at Karkinos Healthcare, who has agreed to speak on the theme United by Unique on occasion of the World Cancer Day 2025. Dr. Malini brings more than 30 years of medical practice with particular focus on health screening programs for women in rural areas. She has also been the founding member and vice president of the first overseas chapter of Indian Medical Association in Qatar. She is also the project administrator of World Health Organization initiatives on cervical cancer prevention and is championing projects in Tamil Nadu and Karnataka regions. Dr. Malini, cancer carries a lot of stigma and fear. How can we address this during cancer screenings in urban and rural areas?
Thank you, Bharat. When looking back at India's cultural history, people were treating cancer as an inevitable end. Whenever a citizen was diagnosed with cancer, there prevailed a looming sense of helplessness because people were very reluctant to hear or even speak about cancers. Unfortunately, this fear is deeply ingrained in the rural areas even in the present days because this is mainly due to lack of education, lack of knowledge about it, and lot of taboos, myths. One such myth is if anybody suffers from cancer, they say it is due to the curse of God. And there are plenty of stigmas surrounding this disease. Because of this, there are a lot of misconceptions. One such misconception is cancer is contagious. So this leads to social outcast and isolation in the villages, not only to the patient, but the entire family. Hearing this, people hide their symptoms and suffer in silence, and they don't take any medical help. Instead of that, they go and do in something traditional medicines or even some spiritual methods, and in the process, they fall a victim to the cancer. And this is very predominant in the rural areas, especially. And also, there is, especially as women, she's very much worried of being thrown out of the house and ending in the divorce. So she definitely hides the symptoms to the family also. So this is happening in abundance in this areas. Another misconception is that cancer can be diagnosed only very late and there's no hope for any treatment. This is mainly because of lack of facilities in the villages. So whenever they get some symptoms which are persistent and recurrent, the citizen goes to the village doctor. The village doctor treats them for some time, and when it's not successful, they are referred to the nearest town. The town doctors also try their best, and finally, if nothing is working, then only they are referred to the cities which are equipped with the latest PET scans, etc. By the time it's too late, and the citizen succumb to the disease. We heard a lot of this during our rural area camps, that we sold our properties, we sold everything to save our parents, but nothing could save them. So this is the knowledge and things which are going. Whereas in urban areas, entirely it's different. People are very openly speaking about cancer, openly listening to the cancers. And this has created a greater impact on this. Narratives are changing because a lot of survivors are coming in public domain to talk about how they fought the battle of cancers. To name something, famous personalities, some actresses like Sonali Bendre, Manisha Koirala, and the famous cricketer Yuvraj Singh, all of them come to public domain to explain how they fought the battle of cancer and became victorious, and the survivors, or conquerors, I can call it. So this is happening in the areas. So in Karkinos, we did two major projects in the rural areas, and we were able to screen about 15,000 women among the population, which was distributed in 12 to 13 villages, districts, 12 to 13 districts. So how did we approach the rural population is we engaged with the community, an NGO which was microfinancing the women self-help group. And we first we created awareness to the president as well as the 500 staff under them. And it was successful. They first submitted themselves to screening, and later on they became root soldiers to go and bring the people from the villages. So from this experience, we thought awareness is the most important key for early detection. In the process, we learned the important parts about awareness. Awareness was well received when it is done in a smaller group with 20 to 30 people, citizens sitting there, and a doctor. Because they are not shy, they shed the shyness, they talk everything, they raise their concerns, they raise their doubts without any inhibitions, and they were able to understand. We also understood that it should be in the local language, the native language, which the citizens will be able to understand it better. And also, the content should be simple. The examples and metaphors should be customized according to the education background or the understanding capacity of the citizens. We can't give the same awareness to every community. We needed to think. And in this, two important contents were added. One is the symptoms a citizen should not ignore to seek physician's advice, especially when the symptoms are recurrent or persistent. And these symptoms need not be due to cancer. But it is the duty of the citizen to go and approach the physician why the symptoms are coming again and again to me. Why are they recurrent to me? And why are they persistent despite the treatment, local treatment? So this might lead us to sometimes to some precancerous or even early cancer lesions so that early detection is made possible. Or sometimes it can be due to another non-communicable diseases as well. So this education is also very important. And we like to leave our women little empowered when they leave the awareness session. So we included this topic of lifestyle modifications, which can help them. So we taught them, they had enough physical activities. So we taught them about yoga, meditation, and good type of cooking methods and good habits, tobacco abstinence and alcohol restrictions, etc., and avoiding preserved food, processed meat, etc. These tips were given to women, which they felt they can handle their families, they can protect their families with by modifying the lifestyle. So, in short, awareness is a great key for us, and we could successfully conduct these two camps in a bigger way.
Clearly, awareness plays a major role, and thank you for highlighting your experience in the rural areas. Going by our theme United by Unique, could you also highlight what are the unifying factors that we can employ to bridge the gaps in urban and rural areas?
Few key strategies are involved in this. The main thing is education, which already comes in the form of awareness. And the second is, most important, is engagement of the community members. Private grassroots members of the community should be involved. So we need to approach the teachers, the village heads, the religious heads of the rural areas, especially, give them the awareness, give them a simple training what they should talk to the citizen and explain about cancer and break the barrier. This played a big role in our thing. And they turn as foot soldiers for us to reach the public. This is an important step, and especially in rural areas. And in IVDP, I told you the 500 staff were people who will reach to villages every week. Once in time, they'll visit the citizens there. That's how they had a good rapport already built because they used to go to collect the interest, etc. So this experience gave us a knowledge that to train them first and to bring them to the venue. So this was a success rate of 98.4%. So this made a great change in our thing. Second thing is investing in the infrastructures, setting up temporary field clinics or camps, as we call it, or mobile vans, or even telemedicine in the rural areas can help us in abundance. And other one is in the urban areas. So we know that a lot of cancer facilities are available, but we should make sure there is the accessibility to every corner of the city, not only placed only in the center of the city. The second point is affordability. We should make sure that no citizen is left in the lurch. The treatment should be made affordable for both affluent as well as the lower economic strata individuals as well. In short, fear is the lock and courage is the key. And when fear is replaced by knowledge, we can make sure that urban and the rural area citizens can unite and fight this war of cancer and stop India from becoming the cancer capital of the world.
Excellent. Thank you so much. I think a great takeaway is fear being the lock and courage being the key. I'm sure our listeners would be very keen to know more as we have more podcast series like this. Thank you once again for your time.